Hello and welcome. I'm Ray Upchurch, and you're watching the Trey Hart Learning Channel. Today, our discussion topic is going to be on ways that you can prevent your heart failure from becoming worse. Now, beside me, I got some notes, and I'm going to be referring to those. As we go through this today, hopefully you'll understand some of the principles and things that we're talking about. If you have any questions, leave a comment and I will respond. So let's get to it. Okay, so what are some of the things that we can do to control our heart failure? Now, you may or may not remember or to prevent it from getting worse. You may remember that some of my initial talks was on prevention of heart failure and ways that you can prevent heart failure from happening. Now, some of the ways that you can prevent is also the same ways that you can prevent it from becoming worse, or to reduce your chances of other things happening. So, one of the things I want to talk about is hypertension. One of the things that may cause your heart failure is hypertension. Now, hypertension simply means high blood pressure, in case if you wanted to know what that means. So, high blood pressure, if you have heart failure and also have high blood pressure, that's going to cause further complications. So one of the things you want to do is make sure that your high blood pressure is brought down to a good level, or to a within normal level. Now, a lot of the principles and things that we talked about in my lead up to the discussions are things that will work for this as well. So if you haven't had a chance, or if this is the first time you're joining me, go back and review some of my videos on heart failure, what it is, and how to prevent that. And that'll help you come up to this point. So, hypertension. What can we do to help ourselves with hypertension? Well, just like heart failure, hypertension, if we reduce our salt, or we live to low salt diets, if we reduce our weight, if we limit our alcohol, it is all beneficial. So one of the things that we're going to talk about is some of the things that we should eat in our diet. So whether it's hypertension or high blood pressure, some of the things that we should include in our diet are things like sweets. We should have sweets, but no more than about 3 times a week. The things that we can have is beans, nuts, and seeds. Now, we should have these at least once a day. Oils, salad dressing, and mayonnaise. Now, we can have 2 to 3 of these a day. Bread. Now, we should have grains and bread. We should have about 7 to 8 servings of these a day. Now, all my previous things, I meant servings. I've left that out. Now, one of the things as well is we can have 2 to 3 servings a day of low-fat dairy. And as well, we could have seafood or poultry or any lean meat, really. And we can have up to 2 servings of that in a day. Now, up to 2 servings doesn't mean that we have to have 2 servings a day. We can have none or up to 2. And as well, vegetables. Now, vegetables, we should have the most fruits and vegetables we should have 8 to 10 servings of that in a day. So, what do I mean by some of these things? Well, sweets, we can have one cup of low-fat fruit yogurt, or 1/2 cup of low-fat frozen yogurt, or a tablespoon of maple syrup, sugar or jam. So we try not to have more than that in our more than 5 servings of sweet in our weekly cycle. Now, the foods, the oils, and stuff like that, and when it comes to servings of those, now 1 serving of most typical oil is one teaspoon, or 1 teaspoon of mayonnaise, 1 tablespoon of low-fat mayonnaise, 1 tablespoon of regular salad dressing, or 2 tablespoons of light salad dressing. As well, we can have, when it comes to our beans, we can have, 1/2 cup of cooked beans is about 1 serving. 1/2 cup of, or 1/3 cup of nuts even is a serving of that. 2 tablespoons of sunflower seeds. Now the low-fat dairy is usually one cup, or of milk, or we can have yogurt. And when it comes to the seafood, the poultry, the lean meats, all of that is about 3 ounces. We don't really want to have more than 3 ounces of that, or two servings of the 3 ounces a day. And our grains, of course, that includes 1 slice of bread, 1/2 cup of cereal a day, 1/2 cup of cooked rice a day, pasta, cereal. When it comes to breads, try to use the healthier options. The whole wheat breads, the brown breads, basically. Make sure that the healthier options rather than just a plain white bread. The plain white bread, while it's not necessarily bad for you, it doesn't have some of the wheat content in it that some of the others does, and so they've taken a lot out of it. So the whole grain breads are actually better for you, better for your digestion, better for your metabolism, and then of course fruits, and vegetables. 1 medium fruit, or 1/2 cup of fresh fruit that's frozen or canned. So these are our servings that we should have per day or per week. Now, one of the things that we should do is in all of our choices, we should try to have very low salt or no salt if we can do. Now, one of the things is training our palate, or have no salt choices if they're available. We do need some salt in our diet, of course. But what we want to do is we want to try to limit this to 1,500 milligrams a day, or 1.5 grams a day is what it equals to. So one of the things you have to do is when you pick up your label, when you pick up your canned goods, or you pick up your goods, the fresh fruits and stuff like that, they don't contain salt in them, but the canned stuff certainly does. So look at your cans. Look at the nutrition labels. It's suggested that if you're using grams, that you should have less than 0.1 grams per 100 milligrams of substance. But I don't really use that. I usually just try to watch how much salt I'm having in a day, and the best way to do that is just get out a pencil and paper and write things down. If you don't want to use pencil and paper, the unfortunate thing is if you're watching this on the internet, which hopefully you are, then there's plenty of resources out there that help you track how much you eat a day. A lot of free resources. There's a lot of free apps. A lot of our computers nowadays are moving to where they also include apps. And one of the apps that I use sometimes, or one of the online things that I do use is from Microsoft. It's free, and by the way, I have to mention that Microsoft hasn't paid me anything to say this, but there's a free program. It's called Health Vault, and it's like having a personal record, really. Not just food. It's a personal record of health. You have to put the information in it. It's also something that you can send to Microsoft Health Vault has a thing where it could be sent to your healthcare provider, some of the information in it. And it also has a way that, if you had like certain conditions and you wanted people to have limited access to information, say for example, you're a person who has diabetes and you're out and about by yourself, Microsoft Health Vault has a little passcode that if somebody finds you down and they find this passcode in your wallet that you can keep in your wallet, it'll give them limited information. The limited information is usually who you are, any emergency contact numbers, and it will sometimes, you could choose what information that passcode has access to, such as allergies and a medical conditions such as diabetes, seizures, those type of things can be put onto it, and they can get onto it, and that it allows them to have a one-time access. Basically, it's a one-go thing. They won't be able to do it again. But if they know nothing about you and they're a healthcare provider, they can get into it and stuff, but only with that access code. And that's only if it's something that you're really interested in. So, blood pressure is only one of the things that we could do. One of the other things that we could do is control our weight. Now, being overweight, it's not an easy thing. It's not an easy fix. You may have noticed that I'm not exactly a slender person myself, but weight is one of these things that if we keep it under control, or for the better we're able to keep it under control, the less likely other things are going to happen, and the less likely our heart failure is going to worsen. And the honest truth is the closer to our ideal weight that we are, the healthier we feel, the more we're able to do things. So one of the things that you can do is use diets to help you lose weight. Now, some people will say to me, well, what diet would you suggest? Well, one of the diets that most people with hypertension use is called a DASH diet. Now, that's developed by people that has different degrees than I am, and I have to say that none of these people are paying me to advertise their products. And the truth is all you need to do is go online, and most of the DASH stuff is free. And so you can go into that and use that to help you manage your diet. And what it will do is, rather than giving you specific lists of foods, it allows you to choose, sort of like I did, how many servings a day of particular foods that you should be eating. And then as you make your dietary plans for any given day, you can write down, say, for instance, we talked about the fruits and vegetables, as you're eating those servings, you can mark off your servings that you had in a day and not go above the recommended servings that you had in a day. Now, there's plenty of diets out there, and people say, well, how do I know which diet is best for me? And it's hard for me to answer that because you're you and I'm me. And what might work for me doesn't necessarily work for you. So the best diet for you is something that works for you. Okay? So there's Weight Watchers, there's Nutrisystem, there's the DASH diet, there's Atkins diet. Talk to your doctor, talk to your healthcare provider, and get their suggestions. Sometimes the healthcare providers have little lists of foods that'll limit your foods to a certain amount of calories, and if you follow their food list, then it will be within a certain amount of calories. And for sure, if you talk to your doc, you've got the amount of calories that they want you to eat, that they feel comfortable for you to eat. So you don't want to go too low on the calories. You don't want to go too high on the calories. And so if you've talked to your healthcare provider, and they can help you determine how many calories and stuff you need to eat. But one of the best things about losing weight is that you do feel healthier. I know when I'm concentrating on losing weight and doing things I need to do and exercising 3 to 4 times a week, then I feel better. I feel like I have more energy. When I don't do that, I feel like I have less energy. Now, one of the things that you want to make sure is that with any of these suggestions, you remember before I was talking to you about the heart failure, is you don't want to overdo it. So one of the things you do want to do is make sure that you're tapering the activities. You're tapering your activities. You don't want to overdo it one day so that you don't have enough energy to do your activities the next day. So I've talked to you about this before. You want to do your activities, but make sure that you're not overdoing it and that you have enough energy to do it the next day. One of the other things that you want to do as well is watch the amount of fluid that you take. Now, for sure, you want to drink the amount that your doctor has said that you could drink. I've talked to you about this as well before in another video. You want to drink the maximum amount that your doctor has told you, but you don't want to overdo it because putting on too much fluid is not good for you. You want to make sure that you weigh yourself on a regular basis. By regular basis, I mean preferably daily. Now, I know we're talking about losing weight, and almost all the diets you'll read will say about not weighing yourself every day because your weight could be variable. But when you have hypertension, you have heart failure, the weighing yourself every day is very important. You want to know if you have sudden increases of weight, which you definitely want to let your doctor know. By sudden increase, I mean that you've gained 2 to 3 pounds in 2 to 3 days, basically. That type of weight gain is not associated with overeating. It's associated with fluid usually. You don't want to stop the fluids that you're drinking. You don't want to do that by yourself without at least talking to your doctor. Always talk to your doctor before you make an action plan, unless it's something that you previously discussed with your doctor about. Sometimes your doctor will say, go ahead and take a diuretic or whatever. And if that's the case, then that's what you need to do. But otherwise, you don't want to do something without discussing it with your doctor, basically. One of the things as well that's going to improve your life immensely is if you smoke, to stop smoking. Now, when you stop smoking, smoking causes restrictions, causes your arteries to get tighter and stuff, and discounting the carcinogens and stuff that it also carries, and how it can make your lungs worse and stuff. If you stop smoking, you'll feel healthier. You'll have more strength. Now, I don't expect you to quit cold turkey, as they say. I expect you to discuss this with your doctor or with a healthcare provider, or in some places there's some things where you could call up that help you stop smoking, and they'll give you a free advice. In Britain there's a lot of free advice in NHS or quit smoking things. In America, there's a lot of free advice that you can get as well. So I don't expect you to do it in one day. I certainly don't expect you to quit smoking cold turkey, because the nicotine withdrawal can, as well, that sudden stopping of the nicotine, especially if you've been doing it for years and years, can actually cause your blood pressure to elevate temporarily, and can actually cause your heart rate to elevate temporarily. So you want to talk to your doctor so that you can stop these things over a period of time, or at least discuss ways, or they can help you with some things that might be medications that will help you overcome some of the side effects associated with stopping smoking. Now, as well, when I talk about stop smoking, I also mean stopping the e-cigs. Now, e-cigs don't carry the carcinogens, and I've told you about that before in another video. They don't carry the carcinogens, so in that way they are actually better for you. But discounting that fact, the nicotine is one of the bad things as well. If you have heart failure and you have hypertension, there's a high likelihood that you also have arteries that are closed and narrow. And when you add nicotine to the mix, which only closes them, makes them tighten up more, then you have a higher chance of causing yourself to have a stroke or a heart attack. So you really just don't want to go there unless it's something that the doctor's doing to help you overcome cigarettes. I know a lot of people have started the e-cigs and in an attempt to overcome cigarettes. The only issue that I've seen so far is in a lot of the people that have started the e-cigs compared to the patches, where a doctor will give you a patch one week, and then in the next couple of weeks they might lower the dose of the patch. In the e-cigs, a lot of people aren't decreasing the amount of nicotine that they're getting. And the unfortunate thing about e-cigs, and one of the things that I've been learning, is that depending on your e-cig device and the heat it has, basically depends on the amount of nicotine you get anyhow. And so while it's already high concentrations of nicotine, even with the basic e-cigs, when you add in these e-cigs that you make yourself, the components and stuff that you make yourself, and you make it hotter, you're inhaling a lot more of that, and you'll feel it and you'll know it, and you'll feel more of sometimes you'll get a little bit of a headache associated with it, but you'll know it. So basically, unless it's prescribed by your doctor, don't do it. And even when it is by your doctor, follow their recommended instructions in lowering the doses, because the whole premise is to stop the cigarettes, to stop the nicotine, to stop those things that are making the arteries close up. And that's really what's going on there. Now, one of the things that, sit down, make plans, make activity plans, plan your week out, set down goals. Don't beat yourself up if you don't accomplish these goals. We can only do things one at a time. It might be perhaps the goals are too strict, or you need to go back on those. But you do need to set yourself goals, and you do need to write things down. So write things down, whatever it is you want to do this week. This week I want to lose 2 pounds, or I want to lose 1 pound. I want to stop smoking. I want to lose weight. We said lose pounds. I want to exercise more. Whatever it is. And, it's okay if we don't accomplish everything. Don't beat yourself up. Just reset your goals next week. And continuing on. Don't give up on setting your goals. People say, oh, this is too hard. I can't do it. And usually it's because they set goals that are so high that they can't achievable. They in work, the place where I work, one of the things that they talk to us about is what they call SMART goals, and it's really an acronym. And all the acronym is, it stands for specific, measurable, achievable, relevant, and timely. And so, one big overall goal you might have is to lose 15 pounds. But this week you're not going to lose 15 pounds. So a SMART goal would be, this week I'm going to lose 1 pound. Measurable is, I'm going to be able to measure that I've lost 1 pound. Achievable, it is usually achievable to lose 1 pound in a week, or 2 pounds a week, whatever that goal is. Relevant, yes, it's relevant to my health. And timely, or I've set myself a goal for when I'm going to do it. And when you accomplish that goal, move on to your next goal. So, if your overall goal is to lose 15 pounds, 20 pounds, 30 pounds, whatever it is, take it in small chunks, accomplish those small chunks, move on. And it's like I said, don't beat yourself up if, this week I'm not able to achieve all my goals, and so I'm not going to do it anymore. That we don't need to do. We need to, continue on setting our goals, and continuing to try to achieve our goals. It's like I said before, Rome wasn't built in a day, so we need to set our goals so that something that we can achieve and something we can do. One of the things you might want to do is try to enlist some of your family, friends, other people. Start a heart group. There's lots of groups out there, Alcoholic Anonymous, cancer survivors groups. Start yourself a heart failure group and talk to some of the local churches. See if you can hold it in their homes. I wouldn't suggest holding groups in your house. You tend to have a lot of people show up, and sometimes they're respectful and sometimes they're not. So, talk to one of the local groups, and talk to one of the local churches. Local churches are usually willing to have you have meeting in their homes. Of course, they still will expect you to be respectful of their premises, and keep it nice and clean, and make sure you clean up after yourselves. But start a heart failure group and meet together, watch these videos, and if you're in a place that has heart failure nurses that are close to you, invite one of them to come along, or reach out to your local doctors and say, hey, is there anybody who could come and speak to us in a group, and you'll be surprised that a lot of them are willing to come and speak to you in a group. Dietitians are willing to come and speak. Physiotherapists are willing to come and speak to you. But get some support. People working together can accomplish a lot of things, and so start a group. You don't have to be alone, basically, is what I'm saying. So hopefully you've enjoyed this and this has been useful to you. I'm going to continue on my discussions on heart failure and different aspects of heart failure. If you have any questions, leave a comment. Start a discussion. Go to my Facebook. I have, it's the Trey Hart Med Facebook. Go to my Twitter. It's Trey Hart Med Twitter. Or it doesn't even have to be mine. There's other people that have invested a lot of money in having these type of things, like American Heart Association or the British Heart Foundation, or other things that may be in your countries. Go to some of their sites and but learn as much as you can. Anyhow, it's been my pleasure talking to you today, and I'll see you next time.